February is National Heart Health Month, and 22 News and Baystate Health are partnering to remind you to get heart healthy. Joining me this morning is Dr. Daniel Engelman, a cardiac surgeon and surgical director of the Cardiac Intensive Care Unit at Baystate Medical Center. So nice to have you here, Dr. Engelman.
Good morning, Ashley.
All month we've talked about how people can be more heart healthy and be more heart conscious. What does that mean? What are some steps you can take to be more heart healthy?
Well, first and foremost, you need to visit your physician once every year, and he should make sure that you have a normal blood pressure and that your cholesterol level isn't too high, because both of these can be fixed with some very safe medications. And in addition, on your own, you need to get regular exercise. The recommendation is 30 minutes per day. You need to eat a low cholesterol, low fat diet. You need to eat a low salt diet, and you need to maintain a moderate weight. In addition, those patients that have diabetes or have a strong family history for heart disease need to pay special attention.
And when you do control all of those factors that you can control, you are preventing your chance of getting heart disease.
There's no question you can absolutely intervene on your own to prevent heart disease. Patients who smoke or are thinking of smoking, that is a real no-no, and that will absolutely increase your risk of having heart disease in your life.
And the most simple thing you can do is that annual routine checkup with your doctor. Make sure that you're
Absolutely. I can't tell you how many
healthy.
patients I see who have never actually seen a physician, and a lot of this could have been picked up and avoided much earlier.
So important. Now, you are a cardiac surgeon. What are some of the problems that you treat?
Well, we treat coronary artery disease, which is blockages of the coronary arteries. We also treat diseases of the aorta, which is the large blood vessel that leads out of the heart, which sometimes can get enlarged. That's called an aneurysm. And we also treat valvular heart disease. The two most common valves are the mitral valve and the aortic valve.
And there's some new technology, and actually this technology is really only offered at Baystate Medical Center, the only actual medical center offered here this side of Boston.
That's correct. Outside of Boston, we are the only center that offers this cutting-edge, newly released technology which allows you to replace an aortic valve without opening the chest.
And obviously I'm not a cardiac surgeon, Dr. Engelman. I'm not sure exactly how heart surgery goes without this procedure specifically. So what is the standard with heart surgery before this procedure has been introduced?
Sure. So if you have aortic valve disease, the standard approach to fixing it is replacing it with a valve that requires a patient to come to the hospital, be put to sleep, then we open the chest, and then we put the patient on a bypass pump which pumps the blood for them and breathes for them. Then we take out the old valve and replace it with a new valve, take the patient off the bypass pump, close the chest, and then the patient has to recover in the hospital for up to a week. This also involves probably a 1-month recuperation at home with some discomfort. It's not especially painful, but patients can't return to work right away, at least 4 to 6 weeks.
Very invasive as well compared to this new procedure.
The new procedure is completely different. For select patients, the aortic valve can now be replaced without opening the chest, without stopping the heart. The procedure only takes about an hour, 1 or 2 hours, I would say, and the patient's only in the hospital for 2, 3, 4 days at most, and can return back to work or can recover and return to their normal activity much earlier. And I brought in a sample of one of these valves. What's exciting about this valve is it's our standard valve that's squeezed and mounted onto a catheter and fed up through the groin, through the main blood vessel, and then deployed in the heart, which allows us to replace the valve without actually opening the chest or doing an invasive procedure.
Absolutely unbelievable what technology can do, and just how far we've come as well.
Yeah.
So it's good to know, and that's offered at Baystate Medical Center. Now, really quickly, Dr. Engelman, heart disease is the #1 killer of women. What is important for women to know?
Well, despite the advances we've made over the last 25 years, for women, the chance of dying from a heart attack is a lot higher than for men. And it's felt that the reason for that is that women present to their physician or to the emergency room much later than men, because women can have atypical symptoms of a heart attack. It's not the standard crushing chest pain that most people associate with a heart attack, but in women it can involve such things as being very, very tired, or sweating, or nausea, or vomiting. These types of symptoms are often ignored for a long period of time, and by the time these women present to a hospital, they have a lot of heart damage and are more likely to die from that subsequent heart attack.
So you shouldn't ignore those signs if they are persistent and
If
they
they're
are
persistent, they should
reoccurring.
contact their physician.
Well, it's wonderful that 22 News has partnered with Baystate Health this month to really bring awareness. It's been wonderful to learn more about how we can all be more heart healthy. So thanks for being here, Dr. Engelman.
Thank you, Ashley.
Thanks so much. Great to have you here. And you can visit baystatehealth.org to learn more about cardiac surgery at Baystate Medical Center. You can give them a call at 413-794-5550.